The next presenter is Dr. Namrata SHREE. She will speak on prevalence of primary angle closure disease, assessment with Von Herrick test, gonioscopy, and anterior segment OCT.
Good afternoon, judges and everyone present here. I am going to talk about prevalence of primary angle closure disease, assessment with Van Herrick test, gonioscopy, and AIOS2025. Glaucoma, as we all know, is a group of chronic progressive multifactorial optic neuropathies in which intraocular pressure, among other contributing factors, are responsible for a characteristic acquired loss of retinal ganglion cell axons, leading to atrophy of the optic nerve with demonstrable visual field defects. Open angle and angle closure are two types. High prevalence of occludable angles and primary angle closure glaucoma in people of East Asian descent suggests that assessment of drainage angle should be considered for all adult Asians attending OPD. Gonioscopy is the gold standard. The Schoffer system grades the angle on how much of the angle is open in terms of geometric measurement in degrees of the angle formed between the insertion of iris into the wall of the eye and the trabecular meshwork. Estimation of peripheral angle chamber depth by a 4-point grading scheme given by Van Herrick is a non-invasive alternative to gonioscopy and gives comparable results. AIOS2025 based on low coherence interferometry with a superluminescent diode have a wavelength of 1310 nanometer allows a deeper penetration and cross-sectional imaging of the anterior chamber and visualization of the angle. This was an analytical cross-sectional study performed over a period of 6 months in a tertiary eyes hospital in Northeast India. A total of 200 eyes of 100 random patients who presented in OPD were included. The inclusion criteria were consecutive patients coming to OPD between 40 to 80 years of age of either gender with spherical refraction between -3 to +3 diopter. We excluded the patient less than 40 years or more than 80 years of age or having a prior laser or intraocular surgery or any history of prior ocular trauma, mature hypermature cataract or severe corneal pathology which may interfere with the gonioscopy, dilated pupil due to any cause, and refractive errors more than 3 diopter. The sample population included left eye 100 and right eye 100, a total of 60% male and 40% female population. In Van Herrick, we found 20 angle were closed and 180 eyes have open angle. In AIOS2025, 8 eyes had closed angle and 192 eyes had open angle. In gonioscopy, we found closed angle on 8 eyes and 192 eyes had open angle. In AIOS2025, we found 7 eyes with closed angle and 193 eyes with open angle. Comparing Van Herrick's with gonioscopy, out of 20 closed angles, we found 12 eyes with open angle and 8 eyes with closed angle. And out of 180, all were having open angle. This gave the sensitivity of 100%, specificity of 93.75%, positive predictive value of 40% and negative predictive value of 100%, giving a diagnostic accuracy of 94%. Comparing AIOS2025 with gonioscopy, we found out of 7 eyes having closed angle, 3 were having open angle on gonioscopy, and out of 193 having open angle, 4 were having closed angle on gonioscopy. It gave the sensitivity of 50%, specificity of 98.4%, positive predictive value of 57.1%, negative predictive value of 97.9%, and diagnostic accuracy of 96.5%. We did a cross tabulation in which 20 eyes having open angle, 20 eyes having closed angle in Van Herrick, we found 15 were open on AIOS2025, and out of the 180 open angle on Van Herrick, we found 2 were closed on AIOS2025. Gonioscopy is considered as the gold standard, as we all know. Sensitivity and specificity values of Van Herrick with gonioscopy as reference was 100% and 93.75%, vindicating its value as a good screening test. Negative predictive value of 100% indicates that Van Herrick grading can be useful in ruling out case of angle closure with accuracy. Similar results were found by the study done by Foster PJ et al. A high specificity value indicates AIOS2025 could be used as a confirmatory test. Similar results were found by Radhakrishnan et al. So we conclude saying that angle closure glaucoma is a sight-threatening condition that can result in profound visual loss In the early stages and in predisposed eye, the disease is curable by a non-invasive laser iridotomy. Thus, early detection and treatment is really important. The Van Herrick method, because of its high sensitivity and high negative predictive value, can be used as a screening tool. AIOS2025, on the other hand, can be used as a confirmatory measure. Gonioscopy is mandatory tool in evaluation of anterior chamber angle assessment, and none of the above mentioned can replace it. Thank you.
These are all well recognized clinically assessment for the anterior chamber angle.
Yes.
What new was in your study? What was new in this study?
So it is just to emphasize the role of gonioscopy and not to replace it with any other method of assessment of the angle of the anterior chamber.
So suppose anterior segment OCT does not have a dynamic contour.
Yes.
So gonioscopy is better than anterior segment OCT in detecting.
Yes, sir.
So what message does it tell ultimately for the take-home message?
So take-home message is that if we have to do screening on a huge population, we can go for Van Herrick methods that takes less time, and for diagnostic measures we can use AIOS2025, but ultimately if the patients are diagnosed with glaucoma, we should go for gonioscopy in each and every one.
I think you should put it like this, that in a big country with big population of India, where all the instruments are sometimes not available in the remote areas, the basic foundational methods of our glaucoma assessment are equally good. Secondly, gonioscopy is mandatory not only to assess the angle but also to find the reason sometimes. Like we may find that there may be some posterior synechiae, or there may be some there may be new vascularization or something. So we must always do gonioscopy in each and every patient, which is not nicely possible with AIOS2025. I would say that will be better then. So total dependence on the new technology should not be there. Clinical acumen is equally important, and of course clinical acumen is available at remote areas also. So that should be considered. That may be the additional part of your message.
Thank you.